and welcome to How to Gastro. In today's video, we'll be speaking about a very important childhood disease, and that is strep throat. So let's get started. So what is strep throat? Strep throat is a bacterial infection that causes inflammation and pain in the throat. This common condition is caused by group A Streptococcus bacteria, more specifically Streptococcus pyogenes. Strep throat can affect children and adults of all ages. However, it is especially common in children between the ages of 5 and 15. So from this definition of strep throat, we get that it's a bacterial infection, which is actually caused by a very specific type of bacteria called the Streptococcus pyogenes bacteria, more specifically a group A Streptococcus bacteria. So when one has this infection, they suffer from inflammation and pain in their throat area. So this is actually a pretty good look of what actually happens here. We see these spots which are red and tiny, which develop on these patients' soft palate. There's inflammation of their uvula. Their tonsils become inflamed and they can become full of pus as well. Their tongue is also sometimes very pink and inflamed, and just the entire back of the pharynx and throat area is red and inflamed and very painful for these patients. So you'll often hear these kids saying, "Mom, my throat really hurts." So now that we know what the definition of strep throat is, let's take a closer look at what actually causes strep throat. So as we mentioned in the slide before, the cause of strep throat is a bacteria known as Streptococcus pyogenes, which is also known as a group A Streptococcus. Streptococcal bacteria are highly contagious and they can spread through airborne droplets when someone with the infection coughs or sneezes, or through shared food and drinks. One can also pick up the bacteria from a doorknob or other surface and can transfer them onto their nose, mouth, or eyes. So something very interesting about this bacteria is that it's spread very quickly by these airborne respiratory droplets. So when somebody coughs or sneezes, multiple bacterial droplets are sprayed into the air, and if someone comes into close contact or actually touches a person or touches any surface that may be contaminated with these bacterial particles, and then they touch their eyes, nose, or mouth, they can become infected with the disease. So this is why the disease is actually very common in children of kindergarten age. So usually in the kindergarten, there's multiple kids between the ages of 5 and 10, and when someone is in close contact or sneezes or coughs, and then they share toys or they share food and drinks, they can actually contract the disease in this way. So this is how one can contract strep throat. The signs and symptoms of strep throat. So these patients will have a sudden fever, especially around 101 degrees Fahrenheit, which is around 38 degrees Celsius or higher. They'll have really little red spots on the back part of their roof of the mouth. So if we come back to this picture, you see what those red spots on the soft palate looks like. Their tonsils can also be red and swollen, and these will appear as 2 round lumps in the back of the throat, as well as white patches on them or elsewhere in the throat. They can also have a headache, chills, a loss of appetite, swollen lymph nodes, especially in the neck region, and a trouble swallowing. So as we can imagine, if their throat area is very red and inflamed, it's very difficult to speak, so they'll also have hoarseness sometimes. They'll have difficulty in eating or refusal to eat, and they'll have their trouble swallowing because their throat is so sore. The diagnosis of strep throat. So the doctor will examine the patient's throat and check for the signs of inflammation. They will also check for the swollen lymph nodes in the neck region. So if the doctor suspects strep throat, they will do a rapid strep test in the office. So this test actually determines whether the patient has the strep throat infection or not. So here, the doctor will swab the back of the patient's throat with a long cotton swab, collecting a sample, as we can see here. So the throat is usually swabbed in the area of the tonsils, which is actually at the posterior wall of the oral cavity. And then a sample is prepared and tested, and the results will be available in about 5 minutes. So this is actually quite a rapid test to check for the presence of the streptococcal bacteria. And as we can see, a positive result means 2 red lines, and the negative result would just mean 1 red line. So if we have a test line which also appears, then we know the patient tests positive for the streptococcal infection. The treatment of strep throat. So because of the potential for serious complications, strep throat should be treated with antibiotics as soon as possible. Antibiotics used to treat strep throat include the following. Phenoxymethylpenicillin is taken orally and is the most common prescribed antibiotic for strep throat. Amoxicillin, this is a useful oral penicillin alternative as it can be given with food, which may also help people to remember to take all of their doses. Benzyl penicillin or procaine penicillin is given as a single intramuscular injection and may be used in patients who are unable to take penicillin orally or are unlikely to complete their 10-day oral course. Erythromycin ethyl succinate is a suitable oral antibiotic alternative for people who are allergic to penicillin. So with oral antibiotic treatment, the full 10-day course must be completed, even if symptoms resolve after only 2 to 3 days, to ensure that the infection does not return and to minimize the risk of developing rheumatic fever and especially kidney disease. And lastly, let's just briefly explore some complications with strep throat. So potential complications of untreated strep throat infections include middle ear infections, which is called an otitis media infection, sinus infections, which is called sinusitis, pneumonia, and meningitis. More serious complications include scarlet fever, and this is a streptococcal infection characterized by a prominent rash, inflammation of the kidney, which is also called post-streptococcal glomerulonephritis, rheumatic fever, which is a serious inflammatory condition that can affect the heart, joints, nervous system, and skin, and post-streptococcal reactive arthritis, which is a condition that causes inflammation of the joints. And that brings us to the end of this video on strep throat. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe, and share. And please make sure you turn on your bell notifications so you'll be notified every time we have a new upload. If you'd like to download a copy of this presentation, please do so by clicking the link in the description. Take care and bye for now.